Now, it wasn't always recognized that there was a need for pairing a clinician with law enforcement. So how did this come about in our community, Meg?
I think approximately 7 years ago, community leaders identified a need to pair law enforcement with crisis clinicians. So the behavioral health unit was piloted with one officer and a clinician. And that is a service that police officers can refer to, and typically they are referring people who have frequent contact with police, and the result is that they're not getting their needs met or addressed. So right now, there are 3 clinicians that work with Portland police officers to respond to those folks in our community, again, who have frequent police contact, but with the result being they're not getting needs met. So
it was kind of towards the end of my time at Outside In, and we had created, with the funding of a SAMHSA grant, a dual diagnosis ACT team. It was phenomenal working with young people who had severe and persistent mental illness, and also were struggling with addiction and chronic homelessness. And I still carried a very small caseload of some of the more challenging young people to work with who had been in the system for a long time. And it was the last time I found myself in the back of a police car. So I know, I can see my police partners making, it was, so there's Officer Silverman was on the behavioral health unit for a long time, and we had a young person who was really having some very scary behavior in the community, and the partner police had referred to him, especially in the downtown core, because he was at very high risk of his police interactions. And one of the problems we had is that, as some of you know, people with experiencing these extreme states often get kind of kicked out of all the typical systems. And so on that particular day, we were trying to get a place for this person to get their mail. And we had been trying to open a P.O. box for a long time. And the behavioral health unit came and picked me and my client up from Outside In. And I hopped in the back of the police car. We stopped at Burger King and got milkshakes and burgers. Really, this was someone who was not taking their medication regularly and not actively engaged in treatment, but really active in police contact. And it was just one of those moments for me where I really saw how that need that was born 7 years ago, that came into fruition, that was really partnering with the community and with the mental health experts in the community to come together to really do the right thing for this young person, which was as simple as just trying to get the mail. And I can attest that the back of the police car is not a comfy place to be. I was really cramped back there. But it's just a story that's really stuck with me, and every time I see Officer Silverman, I kind of joke about it. But it was one of my firsthand experiences of seeing police really do things in a different way with folks that have been identified with chronic mental illness.
And you are both independent of the police. You don't ride along with the police. You are independent entities, correct? Just want to clarify.
3 Project Respond clinicians ride along with the police. That's their full-time job. But the majority of Project Respond clinicians work independently, yes.
We might occasionally do a ride-along with the police, and there have been police that have done ride-alongs on CAHOOTS, but generally speaking, even though we have a working relationship with them, we also try to maintain a certain amount of separation so that our relationship with people who don't have a good relationship with the police isn't undermined. But most of the calls that we are dispatched to, we respond to independently and that we handle without the police. There are a certain number of calls that maybe start with a police response, but the police go and determine that either we can handle the call and they can leave, or that our assistance might be beneficial on the call. And sometimes calls that might otherwise be our calls involve the police just because there's a safety concern. And usually it's because the dispatcher receives information that makes them think that the call might not be safe for us, so the police are sent with us or before us just to make sure that it is. But most of the time we respond to calls on our own.
So how long is your shift, and how many calls do you respond to in a shift, both of you?
So we run 24/7, so we run 4 shifts every day, and Daytime shifts are 8.5 hours, overnight shifts are 10.5 hours. Can't talk about how many calls we respond to in a day, but we do respond to between 350 and 400 calls a month, or we have 350 to 400 crisis episodes a month, and that may involve one call, or it may involve many calls, so it varies.
In Eugene, we have 24. We're available 24 hours a day, but we also have certain for 7 hours a day. There's 2 vans available during the peak hours, the busiest hours of the day. So we have a couple of a few overlapping shifts. In Springfield, we're available 18 hours a day, but we're going to be available 24 hours a day soon. If I work a 12-hour shift, I'll probably respond to anywhere from 15 to 22 calls, maybe. So we have a large call volume, but the calls can really range a lot. So we might get sent to check on somebody who's gone when we arrive, or they don't want anything. So a call like that might get resolved really quickly. But a call involving a family or a call that's involving somebody with really complicated psychiatric problems or health problems could last hours. So our calls vary a lot in length and in depth.
We receive our calls from 2 sources. Approximately 60% come through the Multnomah County Call Center, or crisis line as it's known. Sometimes people call because they're concerned for themselves, but more often it's either a friend, family member, or other service provider. 40% of our calls come from police agencies in Multnomah County, so that would be Portland Police, Gresham, Multnomah County Sheriff's, Troutdale. So in those cases, those calls come directly from BOAC. So a police officer would get on scene, have concerns that part of what was happening was related to a mental health issue, a mental health crisis, and then request that we respond through BOAC.
So the majority of our calls come in through the non-emergency police, fire, and ambulance dispatchers. We can also be reached through 911, but we're technically not an emergency service. We're a crisis service, so we're sort of in our own category. But the majority of our calls originate with the police, fire, and ambulance dispatchers. But we might, because we are constantly patrolling the community, naturally we encounter people needing assistance. So we might see somebody fall down, we might witness a fight, we might see somebody who's in distress for some reason, and we can self-dispatch to help them out. We also, if we have a client that we're concerned about, we might make a point of doing a follow-up with them. So we might self-dispatch to go track somebody down to deliver follow-up services. But the majority of our calls, originate with the dispatcher.
And Juliana, is the Unity Center, are they connected to police radios? Are you monitoring any of the calls?
No, we
no.
receive, we are licensed as an emergency room with waivers for psychiatric care. So we're set up like any other emergency room with connection to the EMS radio system. So EMS will radio in and tell us that they are bringing someone. But we don't monitor police radios.
Talk about when CAHOOTS and Project Respond, when you do respond, when you're first on the scene without the police, and what instances? Who responds first on the scene when you get a call? Describe that a little bit.
So 40% of our calls come from police agencies. So when they call us, we go. We triage calls from police agencies to the top of our response list. So obviously they're there first when they call us. 60% of our calls are dispatched through the Multnomah County Call Center. So for every call we go on, we make a clinically informed decision about whether we request police presence or not. And what determines that is safety. So ideally, we're going to get information about whether the person has weapons substances, whether the person is under the influence of substances, and that's a concern because that impacts judgment and insight, whether the person has a previous history of violence, whether the person is currently endorsing a plan to commit violence either towards other people or towards themselves. So if we're concerned that the situation or the scene isn't safe, we're going to request police to accompany us and ask that they secure the scene, and at that point we're going to do our assessment. So, you know, we don't have crystal balls, so sometimes we get on scene and we've determined that we don't need police and the circumstances are such that we do need police. So we will regroup and ask for police assistance. Conversely, we'll get on scene with police and determine that they're not necessary, so we'll clear them from the call. So it's always a dynamic situation.
Yeah, our approach is similar. There's similar dynamics at work, but I think that maybe one of the main differences is that most of our calls don't involve the police, and so most of the time we're making contact with people without the police. But that can look a lot of different ways because there are people that have been calling CAHOOTS for the entire history of the program. Like there are mentally ill people in the community that have been accessing services from CAHOOTS and Whitebird for decades. So there are people that we see that we are very well acquainted with, and then there are people that we see that we have never had contact with before, and so that kind of guides to some extent how we might approach a situation. If we're getting sent to check on somebody who's unconscious, obviously that's how we're going to approach them is different than how we're going to approach somebody who's standing on the street corner talking to themselves, or that sort of thing. Whether there's a difference in how we're going to approach somebody if they solicited our help versus if we're being called by concerned citizens to inflict care on them. But and regardless, we always take a certain approach of trying to we try to approach people in a manner that's non-threatening. We try to state what our intentions are, which is to to offer them assistance if they want it, not to punish them or to judge them or make them feel stigmatized. We always try to approach people in a sort of gentle, non-threatening, compassionate sort of way, and usually that means that people will be at least willing to talk to us, even if they're not willing to accept services from us or go with us somewhere.
Right, and in what type of situations then would you require or involve the police?
Again, that would go back to situations where we're concerned that the situation or the scene is not safe. Again, so if we have information that there are weapons present, that there has been physical violence, that somebody is threatening physical violence, if someone is so impacted by substance use that their impulse control is really impaired or their judgment is really impaired. So again, safety drives whether or not we request assistance from the police.
That applies to CAHOOTS as well. I think we really try to keep the police out of situations as much as possible. So we really don't end up needing to call the police very often, but sometimes we do, and that might be because, say we are in the process of transporting somebody to the hospital who's really psychotic, and in the back of the van they start destroying property and disrobing and telling us they're going to attack us when they get out of the van or that sort of thing. Sometimes we go on calls with people who are dangerously inebriated, and we want to take them to the sobering station because it's not safe for them to be drunk and passed out in freezing weather, but they aren't cooperative with us, and so we might request the police to put a hold on them at the sobering station or in the ER to make sure that they don't die out in the elements. So usually it's if we have we are dealing with somebody who's unsafe, either because they're not able to take care of themselves or they're acting dangerously towards others, and we really can't justify just backing away from the situation. But we'll always, exhaust ourselves trying to get them to cooperate with us before we get the police involved. And then when we do get the police involved, it's only to make sure they get to the ER or the sobering station in some cases.
Describe the behaviors of a person experiencing a psychological crisis.
I think it ranges by individual, but certainly things that we see at Unity when people are coming in who are in a psychiatric crisis include intense feelings of fear, which then can often be manifested in some agitation or aggression. We can see people who are feeling really sad, and that's perpetuating some behaviors such as making some actual harm to themselves or their bodies, or just talking about that. You know, I mean,
Psychotic behaviors and
yeah, I mean, I would say,
delusional.
yeah, I mean, from a personal philosophical perspective, I really try to stay away from some of those like medical terms and try to just describe the authentic range of human experiences that people have in big crises. I think everybody who's in a human life understands that there's times where we're angry and sad and mad and glad, and that is expressed in a variety of behaviors and verbalizations. And so I guess, I'm sorry, you're asking me to answer a question that I will probably answer in a little bit more of a holistic way, because I think it can look different for everybody. Someone can come in really quiet, internalized, doing some behaviors that have helped them feel soothed in the past, but can be dangerous, such as head banging or hair pulling. And those people can be even in a more intense, like really dangerous psychiatric crisis than someone that might come in with really big explosive behaviors that are really just an expression of their frustration of where they're at in their caught in the system or in their life experience.
So you, CAHOOTS or Project Respond receives a phone call or receives a call that you feel you need to go out to, and describe the scene. Who arrives first? How do you communicate? When the police arrive, who takes control of the situation? And when the police do arrive on the scene, what information have they already gathered? What information do they share with you? Do they share the information with you? Does an officer ask your opinion? What questions do they ask? Brenton, want to go?
Well, we get varying levels of information as when we're given a call. So we may be told, may receive a lot of information. We may be told that this person, we're being sent to check on somebody at the request of a family member in another state who's worried about them because they lost their job or they're going through a divorce and they've been making statements about wanting to commit suicide, and now their family members are unable to reach them. And we might get a vehicle description. We might get contact information for family members. We might get all sorts of details that will help us to go and to find the person and to ideally make sure they're okay or offer them assistance. But in other situations, though, we might get very few details. We might really not know what we're getting into, and in those situations, we have to maybe approach things more cautiously. But again, it kind of depends on the nature of the circumstances and how concerning it is. Whether we have a history with the person, whether it's somebody asking us for help or somebody else calling for them, all of those things sort of determine how we're going to approach a call.
What values do you take with you to each call? I know you take care of yourself physically, you get enough rest, things like that, but how do you prepare mentally when you go out to encounter someone experiencing a psychological crisis?
Well, I think that for myself, even I've worked on CAHOOTS for a long time, and I'm really comfortable doing the work. But I still, I've been doing it for almost a decade, and I feel the need to come into to start my shifts with my head in the game as much as possible. And so I do try to go to work well rested, well prepared. I try to get there early. I try to make sure our vehicles are stocked with all the equipment and the resources that I want to have to be able to give to people. So I really want to basically for us to be the provide the best service that we can, and so I try to come to my shifts feeling good, feeling grounded, feeling well rested, feeling nourished, feeling hydrated, feeling basically ready to do work that can be really emotionally draining.
I just want to, yeah. I mean, I was thinking usually at Unity, if I'm asked to intervene in a crisis, it's because everybody's gotten, right? Once you call your boss to come in, it's because everybody's gotten really tired. And some of the things that I do, I actually try to talk about out loud because I'm also modeling, I think, for what the culture and approach that we want to have for people who are in crisis. So certainly just taking the time, even with the staff, like, oh, hold on, I need to take a few deep breaths to make sure that I have my nervous system regulated, that I believe that if we go into situations with an unregulated nervous system, what happens is that then we mirror each other. I also try to ensure that I'm like understanding when I might have my own triggers, when things come up for me that are activating me, that I take a pause. And I had to spend about 45 minutes one Friday night with a number of our security partners at Unity working to de-escalate somebody. And I think it was, I'm not afraid to say, oh, hold on a minute, I'm just going to take a 5-minute break because I'm starting to feel, it's like, I'm feeling myself get upset, and I want to just make sure I'm in my best self for this moment. And I think the more we can do that and just own that we are part of this interaction, that's really how I want to show up when we're working with someone who's in a crisis.
And
Sorry, I just also wanted to say that I think it's really important, especially for younger people who are starting out. The need to fix everything for everybody is very strong, and that's a good thing in a way. But it's really not possible to fix everything for everybody. When we come on scene, we're seeing a snapshot, and it's really the last page of a really long story. So we're not gonna. It didn't start overnight, and we're not going to be able to fix it overnight. But we want to communicate with people, or to people, like Juliana said. We want to be aware of our own presence, our own interpersonal neurobiology. Like Ellen said during lunch, that relationship is what was really essential to her. So if I can help someone slow down the train, and really engage them in a partnership to say, I really want to work with you to figure out how we can sort this out. Do you want to work with me? Yes, I think it would be great if you could move right away today, but I don't think that's going to happen. In the meantime, what can we do? So really supporting people and knowing that they don't have to fix it, but they really want to enter a partnership with people to help them be curious about what the problem is and what possible solutions there are.
And what is the role of the police officer in helping you perform your job? Do the police protect you?
I would say yes. We call the police for assistance when we're concerned that a situation isn't safe. And for many people, their experiences with police officers aren't positive because they associate it with being in trouble, being arrested, not good things. Conversely, though, for some people, police presence is calming, it's soothing, that they would much rather, in some cases, talk to police officers than they would rather talk to a mental health professional because their experience with the mental health system, unfortunately, hasn't been positive. So, at their very best, I think police presence provides a sense of security and safety, and it really just brings down the level of tension in a room.
For you to perform your job, to protect you, do you feel that?
I think for my job, they're essential. That we respond to people who are in mental health crisis, and along with that comes some dysregulated behavior because people aren't at their best. They're not feeling in control, and that can include violence, coupled with the fact that many people have weapons, many people have firearms. So we're going into scenes that aren't secure, and we rely on the police to help secure the scene so that we can do our job, so that we can assess and provide crisis intervention.
Well, I think the police would agree with us that a lot of the situations they go into, they really don't need to be there, and oftentimes their presence is not wanted or helpful. And I'm not saying that to badmouth them. I'm saying that because it's obvious much of the time, and they acknowledge that, and that's why we're lucky that we have the kind of relationship with them where they will often just back out of situations and let us take over and let us handle it when it's apparent that they're not needed or that they're agitating somebody. A friend of mine who's a paramedic in Oakland wrote kind of an interesting thing about working with the police, and he came from kind of more like an activist background and had a very adversarial relationship with the police, and then began working in EMS where he had to sort of resolve some of that. But I have a quote from him here that says, so the deal is this: cops can be immensely helpful or tremendously detrimental to patient care. They can keep frenzied family members from interfering with the treatment of injured or sick relatives, or they can increase the scene tension. So I think that's true when we do go in situations that are totally out of control, and the presence of the police can be sobering, can allow us to can help calm people down long enough that we can tease out what's going on and and begin to really help people. But much of the time, their presence isn't needed, and that's why we try to often relieve them as quickly as possible.